My name is Klára Jiráková. I come from the Czech Republic. I work as a lawyer and an IT project coordinator in the IT department of the Vysočina region from the Czech Republic. And I serve as the coordinator and project manager of the National Contact Point for eHealth for Czech Republic. On the European level, I currently serve for the fourth year as the Czech of the eHealth Member State Expert Group, MSEG in short. And that is a group which puts together the representatives of national contact points for eHealth from all member states, and also from the representatives from DG Sante of the European Commission. So we, along with colleagues from other NCPs, the national contact points, and with Commission colleagues, agree on the framework to exchange health data, because this is a very complicated issue. It goes into many domains: security, legal, semantic, technical. So we all have to be aligned so that the exchange is safe and reliable. Then on the national side, I coordinate the national contact point for Czech Republic, which means that we have to make sure that the data that goes out of the Czech Republic into the MyHealth@EU infrastructure is in line with those rules that we agreed upon on the European level. One of the biggest challenges that we have right now, and it has been mentioned a number of times during the Experience Days presentations, is data quality. And that's where testing tools such as the IHE testing tools are very important, so that on the national level we're able to see where we have our weaknesses, we can test the systems, make sure that the data coming out of them is interoperable, and we can use them in the cross-border level. For me, it's very important in the first place to present what has been done and developed in terms of the MyHealth@EU services, what is already working as in operational, and what are we working on. It seems to us that it's obvious, but the community is so large that we need to communicate our work and explain our work to the rest of the community so they will understand what is going on, let's say, the cross-border services in the EU. That's one thing, to promote our own work, and obviously also to learn about what's going on in other areas, because the healthcare or e-health domain is great. A lot of people are working there and a lot of projects are going on. So Experience Days are a perfect opportunity to find out about these other projects and initiatives, and let's say get together and see where we could find synergies to cooperate. From national level, it's important for me to bring my colleagues from my national contact point team to make sure on the general level that they understand, let's say, the higher purpose of the work that they do on national level. Because sometimes from national level, it's not evident. Why is interoperability important? They get some assignment, they get some rules, but they might not understand the consequences and the European context. That's why we try to bring them to IHE Connectathons and to the Experience Days, and of course to find out about new trends, to speak with colleagues from other countries, because we know that people have similar experiences, they make similar mistakes, and they can learn from each other and find about good practice. The future is in cooperation, and for that we need to meet together at events such as the Experience Days of the IHE Connectathon, because the experts need to speak together, the stakeholders need to speak together, the decision makers need to speak together. That's the only way forward. If we would stay at home and just write to each other and not communicate face to face, I don't think we would be able to arrive at a very effective European health data space.